Behaviour and Training Advisor for Agria Pet Insurance, and I'm here at Stanley House Veterinary Practice with Robin Hargreaves, Director and Veterinary Surgeon and Senior Veterinary Advisor for Agria. And we want to talk about a subject that affects all companion dog owners and that they think about at some time or another, and that's neutering. There seems to be an awful lot of debate and confusion about neutering at the moment, and we just wanted to give you some of the most up-to-date advice and hopefully give you some clarity and some guidelines. Everybody seems to have their own opinion on whether dogs should be neutered, whether they're male or female, and when it should be done. I think it's very easy for owners to get confused. Historically, we've neutered for 3 reasons, and the first of those was population control. It's not that long ago that neutering wasn't as commonplace. Dogs wandered far more, and there was an awful lot of unwanted puppies who were then often killed, and so population control was desperately needed. And thankfully some of the animal welfare charities got involved, and neutering became much more affordable, much more commonplace, and much more acceptable. Secondly, we neutered dogs for health reasons, and then thirdly for behaviour reasons. People thought that if you neutered your male dog, they would be much easier to live with. But now population control isn't such an issue, and there's more studies and research that's making it seem that neutering isn't quite such a straightforward issue. So, Robin, first of all, I know it sounds obvious, but what actually does neutering involve for males or female dogs?
Well, it's, I suppose people would call it desexing, in that we remove the sex organs. That's principally it. In males, we remove the testicles, and in females, we remove the ovaries and the uterus, typically. More recently, perhaps, the female operation gets modified a little bit, and it can be just the ovaries that are removed. But essentially, we remove the organs that are responsible for reproduction and producing the sex hormones.
So what are the health reasons that neutering has been considered for?
I think we start with females. It's probably clearer. And the 2 things that we would probably we would probably make our decision based on is there's a dramatic reduction in the amount of mammary cancer, which is essentially breast cancer, what people would know as breast cancer. Mammary cancer in dogs is very similar and it's equally unpleasant. And there's a wealth of evidence that that is reduced in animals that are neutered, if they're neutered at a young enough age. And also, animals that come in season repeatedly but not breeding will have a much higher instance of a thing called pyometra. And that's an infection of the womb, and that is really, really serious. It tends to come later in life, 8, 9, 10, 11 and above, although we do sometimes see it in dogs much younger than that. But that's an infection of the womb, a sepsis, and those dogs become sick very quickly, and without that being rectified, it's almost invariably fatal. So probably in our practice, we would say that the reduction in the incidence of mammary cancer and the absolute prevention of pyometra would be our principal reasons.
So what about in male dogs?
That's probably something that's less certain. Prostatic disease is probably the thing that people talk about the most. So prostate disease, people are familiar with that with elderly men. It's very common in the human experience. What we understand, I think, with prostatic disease is we get less benign prostatic disease in neutered males. So we get less infections and irritations and less serious prostatic disease in neutered males. Prostatic cancer, it probably isn't as clear as we thought. We perhaps have thought in the past that it was a prevention for prostatic cancer. I think actually the data doesn't really bear that out. It's probably about the same, but the thing to remember is prostatic cancer in dogs is actually pretty rare. So I think the health drivers for neutering males are not so strong. I suppose that's the way you would put it.
So are there any negative health issues about neutering males or females?
Yes, I think you might expect there's a balance in everything. There's always a bit of a quid pro quo. The insidious one that causes probably more difficulty, it's not so acutely serious, but it causes more overall welfare issues, is probably just weight gain. Animals that are neutered simply find it easy to put weight on, and if people don't address that, then that can complicate every other health problem as life goes on. It's a problem in its own right, is obesity if it's extreme, but any level of overweight will exacerbate other health issues as time goes by. So that's perhaps creeps up on people, not so obvious. For females, probably the one that everybody recognises is that there's an increased incidence of incontinence, of urinary incontinence, and it's unavoidable. We have to acknowledge that this happens. It's manageable in the majority of cases with relatively simple medication, but it's probably going to need medication forever if it occurs. I wouldn't be able to quote the percentages, but it's a relatively low percentage of cases, but it happens. And there is a bit of debate going on right now, and has been going on for many years, as to whether there's any influence of the timing of neutering on whether or not that's going to happen. I think we're probably leaning towards the notion that spaying after the first season probably means a lower incidence of that problem. But there is quite a bit of debate about that going on at the moment. In terms of dogs, timing of neutering is quite important. We're not keen on neutering male dogs below the age of 12 months. And actually what we really mean is below the age of skeletal maturity, when the bones are properly fused and solid and strong, because young animals, they have a risk of an injury that older animals don't have, and that is the growth plates where the bones grow from are weak points. So an animal that falls heavily when it's very young could break its leg like anybody else, but it could separate a growth plate, which is never going to happen at any other time, but when you're young. And we think that early neutering and removal of testosterone at a young age means that those growth plates take a little bit longer to fuse, so the risk period is longer. So statistically, we will see perhaps if you had hundreds and hundreds of cases, more injuries in animals that are neutered young. It's an unlikely event for an individual, but statistically it's possibly a factor. So our general advice is neuter male dogs after 12 months of age.
Is there any difference in breeds and types, so giant breeds or smaller breeds?
I think it's just probably skeletal maturity is later in the giant breeds, so we'd probably we'd be more, the bigger the dog, the more stringent we would be about waiting long enough. There's quite a bit of information floating about in the ether about cancer risks and bone cancer risks. I think the truth is that the data doesn't really support any particular conclusion on that. But I think times are changing with that. I think we're getting much better data collection, and I suspect that, sort of watch this space, I think over the next 5 years or so we're going to get a lot more data, and we can probably be a lot clearer about the ancillary risks or benefits. I think at the moment with male dogs it's a case-by-case decision. I think that because the health risks for females are so much more significant, that I think we can be quite clear that a non-breeding female is probably better off spayed. But I think with males, it's much more of a case-by-case decision.
It's very interesting because in behaviour, it's very much the same. It's very much a case-by-case decision.
Yeah.
I mean, people always thought that if you took testosterone away from male dogs, it would be easier, they'd be easier to live with.
Yeah.
But that's not always the case, because quite often, an awful lot of aggressions come from fear or from anxiety, and quite often if you take away the testosterone, which is giving the dog confidence, quite often what you end up with is end up with a slightly more fearful dog who actually has a rise in aggression because that fear is just more, and you also get more fears, more phobias, more touch sensitivities. And it's the same with females as well. It's not as clear cut, I don't think, as we ever thought it was.
I think a lot of it's folklore, isn't it? It's very folklore.
Yeah, it is.
So we'll have people come along and say, I want my dog neutering. When we perhaps delve a little deeper, they'll say it's because it's always chewing the furniture.
Yes, absolutely.
We think, well, it's of no relevance, the hormonal status of the dog.
It will reduce problems where there is sexually driven behaviours, so it will prevent dogs from running off after bitches in season. It might prevent some roaming. It might prevent inter-dog-to-dog aggression in some cases where there's a competitiveness for who's the top dog and the top ladies' man in the neighbourhood. But it isn't the panacea that people have always thought it was, that this is going to calm your dog down. In fact, there's some studies that show increased excitability in neutered males. So, I mean, I think what you said is absolutely right. We're finding out more and more all the time. We're finding out what hormones do and what happens when you alter that hormone balance. And I think maybe 5 years on, we'll think completely differently. Because we no longer have to neuter for population control.
No, that's right. And I think we probably came to this realisation, probably, I don't know, maybe a decade ago, that we don't just book, particularly male dogs, in for neutering. Somebody rings us, I want my male dog neutered. We don't just book it in for the surgery. Those dogs are always, at some point, going to be presented in front of a veterinary surgeon. It might even be on the morning of the operation, but there is a discussion about why are we doing this. And there are a significant minority of cases where we realise that actually expectations are completely awry, and we would be disappointing people enormously if we, carried out this operation with all the, the incumbent expense and whatever it might go with it, to discover that it didn't solve the problem that the client thought it was going to solve because they had a complete misunderstanding about what neutering is about. So I think it's important that a conversation takes place around these things, and even with the females, where we might say, I think we're fully fully confident that it's probably the right course of action. But it's still important that people realise what the downsides might be. And for some of them, we'll occasionally see a dog and say, well, actually, this dog's gaining weight already. The health risk of it gaining more weight is actually more serious than the health benefit of neutering it. So for the time being, this dog needs a diet more than it needs neutering. So these are conversations that perhaps didn't take place so often, a decade ago.
No, I don't think. I think people just assumed that they would get their dog neutered without actually thinking it through particularly. And I think it's people need to have a conversation with their vet, and if they want behaviour to change, they need to talk to a behaviourist as well, because chances are neutering probably won't solve their problems.
No, it could be part of a basket of things that you might do, but it won't. It's very rarely the be all and end all. What I tell my clients is the only thing you can guarantee is that neither an animal that's been neutered will have no part in breeding. A bitch is not going to have puppies, and a castrated dog is not going to father puppies. That's about the only certainty there is. And everything else is a bit of a risk-benefit exercise, isn't it?
So basically, if anybody thought that we were going to tell you what you should do, you're going to be disappointed. It's a decision you have to have with your vet, with your behaviourist, if you think it's going to change the dog's behaviour, and look at every single dog as an individual.